everyone, today I'm going to show how to put on sterile glove. So the first thing I want to do is wash my hands with soap and water, or you can use alcohol-based sanitizers. The second, I'm going to use disinfectant wipe to wipe my work surface. Next, I'm going to put my sterile glove pack on my work surface. But I want to make sure that the cloth end is always face towards to me. Okay, so now I'm folded. And now I'm going to use my finger to reach the underneath and grab this little flaps to open it. And then holding onto the creases to prevent from the wrapper folding back over the sterile glove. So remember that we only have a 2-inch to grab. So next, I'm going to put the sterile glove on my dominant hand. So I'm going to use my left hand to grab. And put my finger together and the thumb tucking and slide into the glove. And I'm going to make sure that I'm not touch the outside surface. Okay. The next, I'm going to put my finger underneath. And again, put my finger together and the thumb tuck in and slide into the glove. See? And adjust my glove. Okay, I'm done. Now I'm going to perform tracheostomy care. Since I'm in the home, I'm going to use this door as my patients today. Okay, I'm going to tell you what's going on here, okay? This is my trach collar, which is to provide the oxygen to the patient. Okay. This is the inner cannula, this is the outer cannula, and this is the trach tie, which is to keep the trach in place. And this is a little dirty finish dressing, and I will just clean later. Okay. So before I enter into the patient's room, I have to make sure that I gather all the material that I needed. And then when I enter into the patient's room, the first thing I have to do is wash my hands, and then second, and then provide the patient's privacy. And then I have to make sure this is our right patient. Use 2 identifiers, such as what's your name, and can you tell me your day and birth, and then match the information and to the patient's wristband. Okay, to make sure that is our right patient. And then the next, I'm going to assess our patient at semi-forward position. And also, I have to just let them know what I'm going to do. This is a normal saline, and this is a tracheostomy care key set. This is a sterile procedure, so we want to open the normal saline first. And then remember that when we open the tracheostomy care cassette, we have to make sure that open away from us. And then we put the glove on. And now we're going to make the sterile fill. Okay, open it. And the shiny side is down. Okay. The first tool is going to clean our inner cannula. And those cotton tube are going to clean the outside close to the trach inserted. And this pipe is going to dry out the inner cannula. We also have the finished dressing with a little slip in it and some 4x4. Next, I'm going to do is keep my dominant hand as a sterile hand, my non-dominant hand as my dirty hand. So first, I'm going to pull some normal saline into my butt. And I'm using my dirty hand to remove the tree collar. Click and remove it. And I want to make sure that I'm doing this rapidly because the patient needs oxygen. And remove the inner cannula gently. And I have to make sure that I'm not touching the patient's chin, the gum, like that. Okay, so this is the inner cannula, and then I put the inner cannula into my first box and soak it for a few seconds. And use my brush tool to brush, and then I put into my second box to rinse in it, and I tap it dry. And then I'm going to use my pipe cleaner to dry it out. Yeah. Okay, so now it's clean and ready to replace it. And I'm gently to insert back it and put back the oxygen. And now I'm going to remove the dirty dressing. Use my dirty hand. And use the 4x4 and dip a little normal saline. The third box, I was using the first and the second box for the inner cannula, and we have the third box that is clean normal saline. So we use a little normal saline to clean the patient. And also we have to clean the trach collar. It may dirty, and use another 4x4 gas dressing, and then put a little normal saline, and then clean it out and put it back. And next, we're going to use the carton tube and put a little normal saline and to clean the stoma, the outer side, the outside, which is the trach inserted the place, and clean. And use another carton tube and put a little normal saline and clean. Okay, and the last step, we are going to use the finished dressing and to put it back. Okay, so we're done here.